Hi, and welcome to the Ask Dr. Angela show with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been just too embarrassed or shy to ask your own doctor a question about your, private stuff? Well, you have come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. OBGYN, she keeps it real. Pregnancy, she knows what you're expecting. Whole body health? Just ask. Dr. Angela has you covered, girl. And now here is Dr. Angela.
What's up, people? This is Dr. Angela, everyone's self-proclaimed favorite OBGYN, and I am so excited to be here for the Ask Dr. Angela podcast. I am getting ready to go and get my workout on. Working out is like such an important part of my life and my lifestyle, and I certainly believe in not just preaching, but living the lifestyle and leading by example. This is a total aside, but one of my biggest peeves is folks that are in the medical profession or the healthcare profession that are preaching health and wellness, and they're like the most unhealthy people imaginable. So when I talk to you or any of my patients, believe me, I am trying to lead by example. The whole look better, feel better, be better mantra came from me deciding to walk the walk. So having said that, let's get right to today's question. It's coming to us from Michelle. Michelle, what do you have for us today?
Hi, Dr. Angela. I was just wondering, how is polycystic ovarian syndrome diagnosed?
Here we go, folks. Good old PCOS, also known as polycystic ovarian syndrome. I have to tell you, Michelle, that's a great question. And I feel like at least a couple times a week, I'm dealing with someone that either thinks they have PCOS or has been diagnosed with PCOS. So just how do we diagnose PCOS? Number one, I'm going to tell you that PCOS is a diagnosis of exclusion, i.e., we're constantly trying to exclude everything else that we might think is causing the symptoms that you're presenting with. The other thing that I'm going to tell you is PCOS can be diagnosed based on your history, i.e. what you tell me, and your physical exam. Probably the number one thing that folks with PCOS tell me are, we've got really irregular periods. That's probably the number one thing or characteristic that I hear about PCOS. Typically, irregular is defined as skipping months at a time. Sometimes these people will have really heavy anovulatory cycles, or they're just not getting a period at all. With regards to physical exam, common findings are signs of hyperandrogenism. And typically when you hear anyone say anything about androgens, it's things that are like male factor, increased testosterone levels. So you may see things like increased acne, increased facial hair, increased hair on the lower abdomen, thighs, male pattern baldness, these kinds of things. The other very common finding that I see with PCOS is something called acanthosis nigricans. And what that is that's, when certain parts of your skin, most commonly the inner thighs, will show signs of like a darkening of the skin. The literature describes it as like a velvet-like appearance. I don't know if I would go quite that far, but certainly you can see that certain areas of the skin, and the place that I most commonly see it is on the inner thighs. The other thing that we'll commonly do, again, in trying to make this diagnosis is a bunch of lab work. We're going to be looking at things like cholesterol levels, triglyceride levels, testosterone levels, and some people, even though this is a bit old school, will look at FSH to LH ratios. With regards to characteristic ultrasound findings, folks with PCOS sometimes will have enlarged ovarian volume, i.e. the ovaries will be really large, or the other characteristic finding that you'll oftentimes read about are going to be ovaries that have like what they call a string of pearl appearance. And what that's going to look like is your ovary with a bunch of small follicles around the periphery. If you think that you have PCOS, I certainly would recommend that you follow up with your OBGYN so that you can have the proper workup. And if it is determined that you do have that, then certainly treatment options can be reviewed. Just right off the cuff, treatment options are always going to include things like lifestyle modification. Again, I'm a huge proponent of things like making sure you have a good diet and are exercising. I mean, those lifestyle changes alone, losing weight will help to regulate your cycles. Other things that we commonly will recommend is something like an oral contraceptive pill, which will actually help to decrease your androgen levels and also decrease the lengths of time that you are exposed to increased level of estrogen. A lot of people forget this, but certainly being on something like an oral contraceptive pill is protective against things like endometrial cancer as well as ovarian cancer. And then last but not least, another common thing that we sometimes implement is putting folks on something called metformin, which helps with insulin resistance. Insulin resistance can be a characteristic of polycystic ovarian syndrome as well. Boy, that was like a mouthful, right? So, Michelle, I hope that I haven't lost you in all of this, and I'm hoping that I adequately answered your question. Thank you so much for submitting your question to the Ask Dr. Angela podcast. Someone is going to be reaching out to you shortly so that we can send you one of our bomb-ass t-shirts. For those of you who would like to submit a question for the podcast, please go to my website at www.askdrangela.com. Please make sure to remember to not only mention your first name, but also where you are submitting your question from. We want to know where you're from. And last but not least, the thought of today is the following. Most of the shadows of life are caused by standing in our own sunshine. So people, please don't be the one standing in your own way. Get out of your own way, people. So until next time, I would like to thank you all for coming and listening to today's podcast. So until we meet again, look better, feel better, be better.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any diseases or illnesses and does not and should not replace treatment for a medical professional. Listening to and participating in this podcast does not create a doctor-patient relationship between you and Dr. Angela Jones. If you need medical advice or assistance, you should consult a physician. Listening to and participating in this podcast is subject to the terms and conditions posted at drangela.com/terms.